Hi there, I am Dr. Rachel DiSanto. I'm a family doctor here at Iredell Physician Network in Statesville, and I serve as the medical director for the network at Iredell Health System. Well, we're here today to talk about measles because it has been in the news, and unfortunately there has been an outbreak in South Carolina just next door, and that is actually the biggest current outbreak of measles virus in the US. And unfortunately, as of the last few weeks, we have had some cases spread into North Carolina, and we now have some cases spreading within North Carolina. Measles is a very dangerous virus that has been around for an awfully long time that we have not seen as many cases of over the last several decades because of vaccination efforts, but unfortunately is making a bit of a resurgence. It's a very dangerous virus that causes multiple symptoms. Usually in the beginning, it'll be fevers, runny nose, really red, watery eyes, and then typically a classic rash, which some people may be familiar with. The concern with measles is that it can spread inside the body and cause trouble, particularly in the brain. It can cause swelling of the brain damage, seizures, and it can also cause respiratory issues. So those are the primary ways when someone dies from measles that happens. Folks that are at risk for measles are anyone that have not been vaccinated for it. The most high-risk people are going to be infants and children because it just affects their bodies more severely. The current vaccine schedule usually begins with a first measles vaccine at age 1. So that also means that all babies up until age 1 have not yet had a measles vaccine, and so they're at very high risk of contracting measles and at higher risk of dying from measles. Also, people who have chronic medical conditions, chronic heart or lung disease, people on immunosuppression therapy, say chemotherapy for cancer of any age, those people are also going to be at much higher risk for measles. Vaccines for measles are very, very safe and very effective. The measles vaccine is one of the oldest vaccines in modern medicine and in the Western world, and is incredibly effective at preventing measles. So one vaccine provides quite a bit of protection, even if someone has only had one vaccine. But if someone is fully vaccinated with 2 shots against measles, then they have a very low chance, incredibly low chance of dying from measles. Typically, we would also say that those folks have a lower chance of contracting measles, and that is still true. But one of the concerns we have in the last several years is that we have started to see vaccination rates for measles and other vaccine preventable diseases go down, and this creates a problem with what we call herd immunity. So herd immunity means that 95% of a population in any given place needs to be vaccinated against an illness to help prevent that illness from spreading in the community. So a lot of people will say, well, it's fine if I don't get vaccinated because if you've been vaccinated, you'll be safe. But the problem is when those rates drop below 95%, even people who have been vaccinated are at higher chance of catching that disease. So we are starting to see that where some people who are, say, only partially vaccinated for measles are catching it. So in North Carolina right now, of the active cases, 31% are in people who have had 1 measles vaccine. No people who have had full dose 2 measles vaccines have been infected, and then the vast majority are in people who have not been vaccinated. If you have those symptoms, so fevers, diffuse red rash, red runny eyes, really runny nose, those symptoms are concerning. Measles is highly contagious, and so the problem there as well is if you have been around somewhere, a grocery store, church, any place where someone with measles has been, that person can spread measles even just in a few minutes in a room to up to 18 people just from that one person. And it can spread, if you can imagine in a crowded space, how much more that could even spread. So it's a very contagious virus. So it's really important if you feel like you have those symptoms or that you may have been exposed, or if you are informed by the health department that you've been exposed, then it's very important to contact your local health department and or your primary care provider and make sure that you get guidance on what to do next. If you have a visit coming up or you are planning to go see your primary care provider and you think you have those symptoms or have been exposed, please call them before you enter the building so that they can give you guidance on how best to safely get care so that we don't spread anything throughout the community. We're really trying to keep this as contained as possible, and it's going to be really important that everybody works together to do that. Just please get your measles vaccine. It's very safe. Even if you are an adult, but you know that you didn't get it as a child, you can get a vaccine at the health department. You can get it at your local pharmacy. You can get it at your doctor's office. If you have children and they haven't been vaccinated, please call and get them vaccinated. The vaccine is safe. It is effective. It absolutely does not cause autism. Those studies have been done and repeated to prove that it does not. And it's very important that your child gets vaccinated. Those vaccines, again, are widely available. Normally we start at age 1 and then a booster dose at age 4. Because we have measles in Cabarrus County, Meck County, Buncombe County, and really starting to be surrounding Iredell and Alexander counties, the health department has said that we can now administer emergency vaccine to infants as young as 6 months of age. So because there's measles spreading around us, the risk is higher. So if you have an infant who is not yet 1 year old, but they're over 6 months, they can get a measles vaccine to get some protection right away. So please call your pediatrician or family doctor, and we're happy to take care of that for you.